Hello, everybody, and welcome to Heart with Sandhya. One of the things I love doing is getting down to the basics of various aspects of wellness. And I have often noticed that sometimes we take so much care of our external appearance, how our hair looks, we're going to the gym, we're eating well. But one oft ignored aspect of our wellness is actually dental wellness and dental hygiene. So this could have possibly two reasons. One is that we just don't think about it much, and until something actually starts to hurt or breaks off, we don't actually think of going to a dentist. But also that for a lot of us, there are some phobias associated around it. And as with every aspect of wellness, a lot of misinformation or too much information as well. So today I have a very special guest who's going to help me demystify and hopefully de-terrorize the entire world of dental wellness. So please join me in welcoming Dr. Rupal Kasabwala. Hello, Dr. Rupal.
Hello.
Dr. Rupal is a dental surgeon with over 30 years of experience. They have a dental specialty clinic in Versova in Mumbai. And Dr. Rupal was very kind to give me time to answer these questions. And so I'm thrilled that you could be with us. It's a Sunday. I know this is probably like your only day off. So thank you so much for joining us.
It's a pleasure.
Lovely. So again, Dr. Rupal, like I said, going back to basics, in your experience, I mean, first of all, I'm sure you'll have like several dental horror stories to tell us, but, and it's like
Some good ones too.
and fun ones too. Yes, I hope so. Yes.
Yeah.
But I think for a lot of time, lot of us, we just sort of put off going to a dentist because also one, we may be scared, but also we're really embarrassed about having left something unattended for so long. In your experience, why do people hesitate to come to a dentist? What are the reasons that people put off to go to a dentist regularly?
Most of the times it's because of wrong notions which people have picked up either during childhood or somewhere along the journey of life. And they need to be corrected that dentistry and dental treatment is not so bad after all. So it is, yes, it's a lot of wrong notions which people pick up.
Mm-hmm, mm-hmm.
And then you have to, then when an emergency arises, then they have no choice. And that's when all the trouble starts.
And I suppose in a way, this is like a myth that perpetuates itself, right? When you go there, when you're already in pain, then sometimes to correct the pain, you have to endure a little bit of pain as well, right? Which then increases your fear of your next trip to the dentist because you're associating it with all of these memories.
Yes. Then many a times we are not only doing dental treatment, many a times we have to also help them to get over the misconceptions that they have regarding dental treatment, regarding the amount of pain that one may get. And it's like more of helping them get over their fears before we begin the dental treatment. So a lot of the dental surgeons do face this.
Wow.
Trying to help the patient get over the fear.
Yes.
And then beginning the dental treatment. So it's quite common, yes.
So actually speaking from a science perspective and from a wellness, mindfulness perspective as well, the fear of the pain actually makes the perception of pain much higher, right? So what's much bigger is when you go in there anticipating pain or fearing pain, you actually feel like, oh my God, this is so painful. Whereas like what we teach in mindfulness is that the same action, say of a drill or something like that, the suffering,
Yes.
while the actual action may be the same, the perception or the suffering related to it can be very different depending on your mental state. So in a sense, you're working on a very mental level as well before you start your treatment, right?
Yes. That's what. We have to assure the patient that the discomfort is not going to be as much as the patient expects. And definitely the procedure is not going to be as painful as he's been told or as much as he anticipates.
Yes. And my understanding is that modern dentistry has taken away a lot of the pain and the sort of otherwise horrific as notions that we may have had about how good
I beg to differ. Dentistry has never been horrific. Dentistry has always been pretty okay. I mean, it's more of a state of mind also.
I
So,
completely apologize. I think it's more the perception. Like very often, as you rightly said, as kids, we would be threatened that oh, if you do this, I'm going to take you to the dentist, and she's going to put the.
oh,
When you
you
do,
tell me about it. No, 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 no. It is, things like, if you don't do this, I'll take you to the dental surgeon and injection maar denge.
yeah.
So these, even phrases like daat tod denge.
Oh,
These phrases are what deeply ingrains that fear into our minds. And then when we actually go to the dentist, it comes back from some corner of your mind, from the subconscious. Those
yes.
things come back. And then those things come and play on your mind so much that you may not be able to be a good dental patient, even if you want to.
So true,
So,
so true.
yeah.
And I mean, in a sense, the anxiety, like you said, heightens the all of the negative associations that we have with it. When in fact,
Certainly.
I was actually looking
Certainly.
to see, do we have any kind of inherent fear of a sound of a drill and stuff like that? And actually, not. I mean, we as human beings, we don't like anything that feels like a high pitched sound. But there's no inherent fear or anxiety. A lot of this is just created from our past, right?
Yes. Yes, yes. We pick up these wrong notions. Otherwise, a child on his own will
Mhm.
never fear a dentist. But because of the wrong notions that he's picked up, he's heard people, he's probably heard a friend of his saying, oh my God, I went to the dentist and I wasn't very comfortable. So that's when it all begins. And
Yes.
then along the journey of life, you do pick up wrong notions.
Mm, mm. But so then, according to you, what is the right age for us to start visiting a dentist? Let's get down to the brass tacks, the basics.
Yes, for children, it would be as early as possible, at least just an introduction to a pediatric dentist.
Mhm.
We have pediatric dentists who do exclusive pediatrics, so they are their setup, their clinic setup, their way of working, their way of approaching the child. It's so pleasing that a child who has a pleasant dental experience will never ever be scared of dental treatment, and vice versa. A child who's had a bad experience in childhood will
Mhm.
always be a scared dental patient, an uncooperative dental patient, and it takes a lot to get it out of his system. So the earlier you take your child to a pediatric dentist, better. Even if it's just go visit the doctor, hello, the doctor gives him a nice star or a smiling face, saying,
Yes,
okay, no cavity, brush twice a day.
yes,
A
yes,
positive reinforcement. And
absolutely.
then
Setting up a good
that
habit, right?
carries forward in your, yes, yes, brushing twice a day. And of course, they have a lot of positive ways of positive reinforcements. And then for adults, of course, once in 6 months, a follow-up is mandatory, so that if there is any initial problem, we nip it in the bud and you don't let it increase too much.
Mm,
And a, maybe a professional cleanup once a year is also mandatory. So earlier the better. And
yes,
then, of course, a follow-up. And then the dental surgeon will always show you how to maintain. See, there is a therapeutic phase and there is a maintenance phase. So once the therapy is done, once the treatment is done, your dental surgeon is going to guide you as to how to maintain your oral hygiene such that you don't land up with too many new dental problems.
yes, yes, absolutely. So, I mean, never more here than prevention is better than cure, right? Because we
Always,
have this one
always,
teeth to back to
always.
basics again, Dr. Kasper. By the way, I have two teenage boys, and we were just lucky that we happened to have a pediatric dentist visiting their play school. And I actually said, what a great idea to set them up for life where they're not fearing dentists. And I have to say,
Yeah.
to date, although their dental hygiene may be questionable, especially during lockdown, they have no fear. And we do go, like I just set a
Yeah.
reminder on my phone to go twice a year, and we just go, and it's our dental treatment is like a fun outing. They in fact have none of even the slight anxiety that I used to have when I first started going regularly for checkups, because I exactly what you said. I had an experience where we lived abroad, no access, and then we suddenly went to a dentist and I had two cavities, but touch wood, none since then, because I've been able to maintain. So never too late also, right?
Yes, yes. It's never too late.
Wonderful, wonderful.
Better prevention is always better than cure. Sorry.
So true, so true. No, so again, the basics of the basics, toothbrushing.
Yes.
There's so many misconceptions about this, and again, such a dizzying array of products and like super specialty creams and different kinds of toothbrushes. Can you strip it down to
Right.
what we really need to be doing? What is the purpose that toothbrushing serves, in fact?
Toothbrushing serves to remove the plaque that accumulates on your teeth, and if you have any food stuck between your teeth,
Okay.
right? And the basic, what it boils down to is soft bristles and rounded ends of the bristles. That is what it basically boils down to. Okay. Uh, the method of brushing, of course, will be suggested by your dentist. If you do not go to the dental surgeon, is circular motions and gentle motions. See, a lot of patients have this misconcept that the harder I brush my teeth, the whiter they will become. The harder I brush my teeth, the cleaner they will stay, which is a disaster. Okay, because enamel is being the hardest substance in the body. It is still like glass. You cannot abuse your enamel. Enamel once lost is never reformed. So you have to treat it with a lot of care and a lot of respect. You cannot go brushing your teeth so hard. It has to be soft, it has to be gentle circular motions, and you have to respect that tissue so that it lasts you for a lifetime.
I have to say, I'm guilty. I come from a long family of a tradition of like really rough brushing. And in fact, I learned that, the rougher you go, in fact, your teeth will start to look more yellow because the
Yes,
enamel is
you wear
getting,
off the enamel, you
yes.
wear off the enamel and their dentine shows through. So they're going to look yellower and yellower. So you are doing yourself a disservice by brushing too hard.
So soft brushes, round bristles, gentle circular
Yes.
motion. We really just want to
Yes.
get the surface of it brushed, right? So if we had to think
Yes.
of it, since you equated it to glass, would it be like we're using like a soft sponge
Yes.
to clean the surface of the
Yes,
glass where we
that's exactly what, yes. That is the analogy which I normally tell my patients. You wouldn't use a hard black scrub to clean your glass surface. The same way you would not use a medium toothbrush or a hard toothbrush. You'd rather use a soft toothbrush. And if your dental surgeon has prescribed you a toothbrush with super soft bristles, yes, then you go in for that, right? And of course, a gentle massaging of the gums with your finger, that does wonders.
Wow.
Specialized toothbrushing techniques are prescribed for people with gum disease, and
Okay.
that is where your dental surgeon comes in to actually demonstrate to you as to how to brush your teeth if you have uh, gingivitis or periodontitis. In very simple terms, gum disease.
Gum diseases, yes. Okay, okay.
Yes.
And,
So
and
that is when your dental surgeon will tell you
okay,
to use a particular kind of a brushing technique.
okay. And what is actually the role that toothpaste is playing? Is it like soap? Is it going to emulsify? I mean, what does it do actually?
Reduces the surface tension so that your the dirt and the plaque accumulated will come off easily. Secondly, it has fluorides, so fluorides will be deposited into your enamel rods, right? And basically to clean your teeth.
Okay.
Desensitizing paste for people with sensitive teeth, yes, we have nanoparticles, we have toothpaste with nanoparticles, which will actually go and plug your dental tubules. So those are for people who have trouble with their teeth.
Okay.
But for normal individuals, a fluoridated toothpaste is good enough.
Okay. What about ingredients like triclosan and these microcrystals that whiten and brighten and charcoal and I mean it's do do they play a
Okay.
role? Okay, I can see some your expression tells it all, but please
No,
edify us because we are being sold all these things today. So
I personally believe that the very mechanical action of brushing is what cleans your teeth. Okay, whatever additives you're using, they may not be always necessary.
okay.
Let's put it that way.
Right. So it's like cosmetics. You know, I mean, the basics. In fact, I just spoke about that. So we have some basics, which is about the cleansing and the maintenance of it. The
Yes.
others are okay. I'd say take your dentist's advice before you buy any fancy sort of extra toothpaste. But otherwise, the fluorinated toothpaste is good enough.
Yes.